Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR. Okay. Alright, Fadi, tell me what's going on with your back, what happened?
So I've been having back pains for many years, probably for too much playing tennis and soccer. I do have arthritis. I know that in all of my joints. I've had surgeries in different places, but it's progressively getting worse every year.
Okay.
In winter time, it gets really painful and locks up quite often. If I stand up too much or I sit down too much, it locks up. And I have to do a lot of stretching, a lot of inversions and
so you do inversion
decompression to relieve that pain. Because sometimes I can't even walk straight. I can't keep my back. It just
so you're walking like forward.
Yeah, back. Yeah.
So how many years have you been experiencing back pain?
I would say at least 20 years.
20 years. So for the 20 years, what kind of treatment, who doctor you saw, and what the recommendation?
I've seen plenty of doctors. Usually they give me anti-inflammatory to relieve the inflammation, and also sometimes painkillers if it gets too bad. I try to use again inversion table, and I've seen some specialists. They've taken MRIs, X-rays, the whole thing.
What they found?
They found a bulging herniated disc.
What level?
Between L4 and L5.
Okay.
That requires surgery to relieve the pain.
So they recommend surgery. How many surgeons recommend surgery?
3 of them.
Oh, so you went to 3 surgeons and all the 3 recommended surgery.
They all did, and one of them told me, listen, if you can take the pain, I wouldn't do the surgery because there's no 100% relief. You know, it might not be 100% effective.
Nobody guarantee 100% of it.
Exactly.
Yeah. So current symptoms, what kind of symptoms do you experience? Do you have sharp shooting pain to your legs?
Yeah, now that the weather is getting warmer, it's not as painful. It's more stiffness in the morning. But in the winter time, when these pains come, I have shooting pain down my left side, sometimes numbness. Sometimes I can't even feel my foot. I can't walk, put any weight on it, or it just gives away. And sometimes I have shooting pains right down my leg, and even tingling sensations. And
you feel it in the whole lower extremity, or you feel it in your feet?
It starts from here, from the side, all the way, especially here in the hip. That 90% of it is probably in the hip, and then it starts shooting down sometimes.
Okay. So how much pain from 0 to 10? 10 is emergency room, much worse.
When I have the sharp pains, it's probably 8, 8.5.
What about now?
Now it's probably maybe 1.5, 2.
Okay, so we're gonna do the motion that aggravate your symptoms. So you let me know how much pain with those motion. Okay, so you said the standing, we'll have you stand up and we'll have you bend. We'll have you stand up. Okay, I want you to bend forward, reach to the floor.
Okay.
And tell me, and mark on your legs how far you can go. So really like touch your legs. Okay, so you like mid.
Knees locked?
Yeah. How much pain from 0 to 10?
Probably 3.
Okay, backward.
It's my hamstrings.
Hamstring are tight. Yeah.
Very tight. Left side, right there.
How much from 0 to 10?
About 2.5.
2.5.
2.5, 3.
So twist left and right. That side bend.
There's some pain there, about 3.
Okay, and the other side. Do you have sharp shooting pain or just localized in the back now?
Just localized in the back right now.
Okay.
That's
in the morning you said or when it's cold you start to have the sharp shooting pain.
Yeah.
Twist.
Some, about 1.
Okay.
Not bad at all.
Okay. So I'm gonna have you do squats and tell me how that feel.
Squats.
So you're gonna bend your knee and try to go down. How's that? And up.
On the back, it's not bad. It's my knees that hurt.
And your knees are hurt. Okay. Okay. So the worst motion was like forward and twisting.
Yeah.
Okay. All right. So everything should be pain-free. I will have you lie in your stomach head over there.
Okay.
Okay.
Take off shoes or?
It doesn't matter. Okay. We'll sanitize the table. So are you comfortable like this? You can put your head actually. I'll take this. You can put your head here. And actually, we'll have you take up your shoes and socks because I'm gonna work on the whole thing. And but you don't have. What about the decreased sensation now?
The what sensation?
You said decreased sensation, like your sensation is less.
Right now is fine, I think.
Fine. Okay.
Yeah.
You can bring your arms back. Okay. Relax. Bend your knees. Let's bend your knees the other way. Okay. Relax. Okay. So it's starting here, yeah?
Yep.
Okay. Have you had any surgeries?
Plenty.
Let's go ahead and go over these.
Right knee, left ankle, both shoulders,
Man, what's going on?
right elbow.
What's happened?
I used to play a lot of soccer and a lot of tennis. College tennis and soccer.
Okay, let's pull this up. So, you comfortable in this position?
Yes.
Okay. Alright. Okay.
And everywhere they operated, they said arthritis was just eating up my joints.
So, but you don't have, it's an osteoarthritis, it's not rheumatoid, yeah?
Yeah.
Okay. How does it feel?
Good. It's okay. It's not painful.
Okay, make sure it's not painful. So, okay. Have you had any abdominal surgery?
No.
Sorry if I pulled you here. You know if it's too much, okay?
Okay.
How's that feel?
It's okay.
Okay. Make sure you breathe, okay? So, when you feel it, show me the line where it goes down. So here,
There.
okay, and going down,
The elbow's down right there.
and there, and going down,
Just
going
this
down
way.
to the side.
Like that, I can
Yeah.
sometimes right there.
So this is the line here.
Yep.
Okay. Okay. And you sit here. Make sure you don't wear any wallets in the back here, okay? Period. Nothing in your back pocket, especially when you sit, okay? How's that feel?
There's pressure there, I feel it.
As long as you don't feel pain, that's fine.
I'll let you know if there's pain.
Pressure is okay as long as there's no pain. So when it goes down to the side.
Uh-huh.
Okay. So your IT band probably tight too. Okay. Is it your daughter in physical therapy now?
No, I'm not doing anything. I've done deep
No,
tissue.
your daughter is studying physical therapy?
Oh yeah, she is.
What's your year?
She's just starting college now.
Oh, nice.
She just graduated from high school.
Oh,
But
nice.
that's gonna be her major.
Yeah, so she's,
Mm-hmm.
that's nice. Yeah. Okay. So you get a lot of scar tissue here, actually. I can feel it. So it's gonna feel cold, okay?
No problem.
And I will show you the scar tissue here. Okay.
I've got scar tissue everywhere.
Yeah, it's part of healing, you know. The problem is when the body does not get rid of it. Because normal healing, the body should get rid of the excess of scar tissue. So, when the body does not get rid of it, that could compress on nerve arteries,
Mm-hmm.
on your vertebra pushing on your disc could make it worse. That's a scar tissue. Feel those knots here?
Yeah.
Okay. Do you guys want to feel the scar tissue, or are you okay?
No. I have plenty. I felt
plenty?
it before. Yeah.
Okay. So it's you can see even like redness where he has a scar tissue. Can you untie this a little bit and cover him?
That's my back.
Yeah. Make sure your belt is not tight in those spots.
I just loosened it.
Like in general,
Oh, okay.
you know. So you have a lot in here. Okay. Is that painful? It's okay.
Oh, it's okay.
Mm-hmm. So it's all around this area. How does it feel?
It's good.
Okay. You feel this knot here. That one. Feel that?
Yeah.
Is that painful?
It's not painful, but I definitely feel it.
Yeah.
It's
You have like a
uncomfortable,
little
but it's
rock
not
here.
painful. Yeah.
Yeah, make sure it's not too much what I'm doing, okay? Because I want to know if you have inflammation, and I don't want to cause inflammation. So if you feel pain with the treatment, and we push the pain, that might cause inflammation and make it worse.
Yeah.
We don't want that. We want to just work on the proliferation stage only. Feel that?
Big time.
Sorry. Yeah. Okay. Well, it's not too bad actually. I had patient had sciatica. They had a tennis ball size of scar tissue here. Everybody was taking images for the back. Nothing wrong in the back, but they did not look at the scar tissue that pushing on the nerve here in the glute area. So yeah, but this is not too bad actually. And that spot. Okay, I'm gonna dig in here because I want to go deeper to this spot. Okay. And here, right in here, this one.
No, I have several pages. This is
Okay. Let me know if it's too much, okay? How's that?
Good. Just a little bit of pressure, but that's good.
Okay. Okay, let's pull your shorts up. Yeah, your IT band is really tight.
Yes, I pulled my hamstring, I don't know how many times.
On the same side here?
On both sides. I pulled both hamstrings at least 7 to 10 times each one.
Wow, man. You're really rough on your body. You're very competitive when you play sport, yeah?
I used to be, yes. I mean, I played collegiate.
Wow.
I still play till this day.
Yeah. As long as you don't feel pain, just stay active, okay? But if it's aggravate your symptoms, take it easy. You might want to do like swimming or something like that just to be easy on your joint.
That's what all my doctors say. I'm like, okay, I'll be in the casket if I'm gonna stop playing sports.
Yeah. Is that too much here?
No, it's fine. I mean, you're right on there, on that knot.
You feel that?
Yep.
Man, that's a big one here. Feel that's right in here. Do you guys see this? You see it's jumping here.
Yeah.
Here. It's just stuck. It's not really going a straight line. I'm gonna do it this way. Yeah. Sorry, is it too much?
No, it's
And
just
you
good
see-
pressure.
You see the redness where he has the scar tissue. Okay, because you set your hamstring and your calf. Okay.
I'm gonna have to send you my daughter, maybe she can learn her techniques.
Yeah, sure. I have online courses for healthcare provider, and the physical class I do it once or twice a year.
She's been interning at the physiotherapy place.
Yeah, nice.
So she bought suction cups. She's always trying, do stuff on people.
Yeah. It will be easier when you use tools instead of using your hand.
Yep.
Yeah. Feel that?
Yep.
And here.
Yeah, I've had left Achilles injury last summer.
Right in here, yeah?
Yeah.
That's where you have a lot of scar tissue here. So your body, probably when you get injured, you can build the scar tissue, but your body's not really breaking much. Okay, so I'm gonna clean up everything. I will have you sit up and get you some water, and you
Huge difference.
can.
Oh my God. I don't feel anything anymore here, and I can go
Nice.
down probably lower.
Let's do the twisting, and then we'll have you step forward a little bit.
The pain was 3. It's probably 1 now. I mean,
Let's drink a little bit more water.
There's hardly ever any pain left.
Drink more water. Do you drink enough water? You're not fasting today, are you?
No.
Okay.
Well, I would do 1 meal a day, weekdays.
Beautiful, good job. We'll go over that with you. Backward. How's that? That's further. That's a lot.
Much further.
Yeah, that's good. Down. Let's mark on your legs how far you can go down. Yeah, that's good. You were mid
I'm
leg.
probably about 4 or 5 more inches.
Yes. Any pain or it's gone?
There's, I wouldn't say pain, discomfort.
Where? And
Same
with which
area.
motion?
Pretty much same area.
Mm-hmm.
Yeah. So I can't even pinpoint it anymore.
Okay, let's drink more water. Because sometimes it takes like a few seconds. And your body gets used to the release and the range of motion. Let me know if you feel it, okay?
Yeah, more to the center now.
It's a center,
More to the center now.
not on the side.
Not on the side anymore. I used to feel it more on the side, but now
Okay.
it's more located to the
How
center.
much from 0 to 10?
No more than 2.
Okay, do me a favor. We're gonna do the range of motion again, but I want you all the time suck your stomach in and range of motion and tell me if you feel pain or it's gone.
Okay.
Okay, so you really belly button in and do the motion.
Yeah, I feel the pain.
How much
Closer to the center.
in the center?
About 2.
Okay.
Nothing there.
Okay, backward.
Towards the center.
It's the center.
Maybe 1.5.
1.5. Okay, what about the bending forward? How's that? That's good. You down to your
It's
ankle.
more hamstrings.
Hamstring
Then
tightness.
Yeah,
Hamstring tightness. Both of them or one?
both of them.
Okay, let's lie on your stomach again. So both hamstrings. Okay,
It feels so much looser.
that's good. Yeah. So I'm gonna do the other side. I was focusing on this side only, and well, we'll do the other hamstring. Okay. Yeah. See that?
Yeah.
And the scar tissue here too. Too much?
No. I'm just breathing out.
Okay, that's good. So I'm trying to work only on the proliferation just to make sure it's purely proliferation, not inflammation. You see, if we get you to 0 now, it's purely proliferation. If not, I'm gonna jump quickly to the inflammation, okay?
Okay.
So let's sit up, drink some water, and tell me how that feels. And how's that?
Okay.
Let's do the motion that you said it's you felt it with the side bend. How's that? 0 to 10.
1.5.
Okay.
0.
Okay. Backward.
Probably 1.
Okay. So
No more
one.
than 1. It's
Okay.
much better though than before.
Bending forward. Look at that. You're almost going to your toes. Beautiful. Good.
Yeah.
Good. Okay. So I'm gonna do.
Go back up without minimal pain.
I'm gonna work a little bit on the inflammation. Do you have seizures?
No.
Okay. So we'll have you have a seat here, just at the edge of the table, and
This way or the other way?
just facing the camera. Okay. See how strong this magnet?
I guess. Yeah.
Okay. So that's what I'm gonna use to work on your inflammation. So if you have mild inflammation, it should take a minute with this magnet, and that's enough. Okay? If it's moderate to severe, usually I recommend patient wear it, like put it in a,
Belt or something.
yep, walk with it, because it's gonna take a little bit time for severe inflammation. For herniated disc, if you're pain from the herniated disc, that's what I give to patient to wear it. It penetrates 2 inches to 2.5 inches, and that help with decreasing internal inflammation.
Yeah, and I used to wear my magnetic bracelet because of my elbow issues. Used to help.
This is like extremely strong magnet, so you don't want to have any electronic closer to it. So and I coat it with anti-inflammatory coating, so that's usually work a little bit faster. How does it feel?
Good.
When you felt it in the center?
Yeah, it was
Okay.
towards the center.
Okay.
Left side of the center. Yeah.
Okay. Okay. So drink a little bit more water and try it again.
Alright, let's do side.
How's that?
There's still some pain, but
0 to 10?
mild. Maybe 1.5.
Okay.
No pain.
Okay.
Significant discomfort, but no pain.
How's that? You're going further now. Look at
Much
that.
further. Yeah.
Yeah,
And
it's a
there's
lot
no
more.
pain, just discomfort.
Okay, so let's do this, okay? Because we know you have arthritis there. I'm gonna put the magnet in the back, okay?
Sorry.
And I will have you do the motion and tell me if your pain gone when you have the magnet. Let's pull this up a little bit. I just want to have the magnet on the spot. Is that on the spot? Okay. Let's do the motion again and tell me how that
Okay.
feel.
So we're going back.
Yeah. How's that? With the magnet on.
Excellent. No pain, nothing.
Okay, let's do the
Not even
side.
discomfort.
Yeah, that's inflammation. That's good. You're going further this way actually.
No pain.
Okay.
Just discomfort.
Yeah. And we'll have you bend forward. How's that?
Very good.
Can you tell the difference when I put the
Yes.
magnet on it?
A little bit, yes. There's an improvement.
Improvement. So that's the arthritic part that we need to work on with the magnet. That's usually I recommend to wear it for several hours a day, depending on how bad is the inflammation. Right, so you had it for 20 years now, we just did ASTR treatment. Can you tell any difference?
Major difference.
What's the
My
difference?
flexibility, my pain level, the tightness.
Uh-huh.
It's not as tight anymore. I mean, I have more motion,
Mm-hmm.
and it's like instead of the pain, it's more of a discomfort, tightness,
Just
but,
the
but I'm
tightness.
much looser. I can feel more flexible.
That's nice. Awesome. Thank you.
Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!